A new study finds insulin resistance within the heart is exacerbating the process of atherosclerosis, leading to the high burden of cardiovascular disease. This is the first study of its kind, looking at what's known as FDG, which is fluorodeoxyglucose uptake within the heart. This is a fancy tool that's utilized mainly in the context of cancer to look at the uptake of glucose in neoplastic cells. But these investigators wanted to see if individuals with insulin resistance, i.e. metabolic syndrome characteristics, if they had low uptake of glucose within their heart, because it turns out that the heart should be metabolically flexible. And in subjects that are insulin resistant because they have central adiposity, belly fat, increased blood pressure, increased glucose, changes within their lipids and so forth, the investigators found that there was a reduction in the glucose uptake in the heart, and that was strongly tethered to the process of atherosclerosis, leading to poor events over time. Now, these individuals were part of what's known as the PISA study, the Progression for Early Subclinical Atherosclerosis Study cohort out of Spain. There was 800 subjects that were tracked for 5 years. And before we go on, let's look at the graphical abstract so we have a better idea of what these investigators were trying to figure out here. I think this is pretty interesting stuff because we hear so much about lipids. We've talked ad nauseum about how LDL cholesterol, despite the fact that the mainstream medical profession is monomaniacally focused on lowering LDL cholesterol, we know there's not a strong statistical association with levels of LDL cholesterol and poor outcomes from cardiovascular disease. We also know that cardiovascular disease is the leading cause of premature mortality here in the US and throughout the world. So we should be looking at other factors that are driving the process of atherosclerosis, or the narrowing or the occlusion of the coronary vessels. They're very small and they are prone to become narrowed by the process of plaque formation, i.e. atherosclerosis. And it turns out that when you become insulin resistant in your body, your heart is not immune to the pathophysiology of insulin resistance. It too becomes insulin resistant, and that is a problem. As you will see from this graphical abstract, the investigators utilized the FDG, which is fluorodeoxyglucose. It's a radio-labeled glucose that is normally utilized, as I mentioned, in the context of cancer diagnosis and progression. But they utilized this in the context of the heart to see if the heart was metabolically flexible. And in the subjects who had metabolic flexibility preserved in their heart, i.e. they had less metabolic syndrome characteristics and better metabolic health, they had increased uptake of glucose in the heart. In contrast, the subjects who had high characteristics of metabolic syndrome and metabolic inflexibility, they had low or no uptake of this radio-labeled glucose in their heart. That was also strongly tethered to the process of atherosclerosis and was linked with other cardiometabolic risk factors. And so let's dive into some of the baseline characteristics. This right here is table number 1. And I want to talk about the differences between the individuals who had a metabolically flexible heart and compare and contrast that to individuals who had little or no glucose uptake within their heart. To no surprise, the individuals who had no glucose uptake in their heart had higher fasting glucose levels, had higher prevalences of diabetes, had more metabolic syndrome characteristics, had increased blood pressure, higher prevalence of smoking, not surprising. But what I think is actually quite interesting is there were non-statistical differences with LDL cholesterol. In fact, as you might expect, the individuals with impaired glucose uptake within the heart actually had lower LDL cholesterol levels compared to the individuals who had higher glucose uptake in the heart, which is quite interesting. The LDL cholesterol ranges in the folks that had more cardiovascular risk factors actually had a lower LDL cholesterol, 133 milligrams per deciliter compared to the 141 milligrams per deciliter in the group that had higher glucose uptake in their heart and less signs of atherosclerosis, which again is quite interesting, and it goes along with everything we've been talking about. LDL cholesterol is probably not the best biomarker for atherosclerosis or cardiovascular disease, but let's look at insulin. Fasting insulin here, between the groups, again, the group that had no glucose uptake, meaning a metabolically inflexible insulin-resistant heart, had significantly higher insulin levels, 7 units per milliliter versus just 5.6 units. And if we can go on down to C-reactive protein, various other markers, blood pressure, and beyond. So I think that is quite interesting. But for background and perspective, you might wonder, why do we care about the metabolic flexibility of the heart? It turns out that the heart is an omnivore organ that can generate energy from different substrates, fatty acids, carbohydrates, and ketone bodies. The flexibility in substrate utilization is essential, and an optimal cardiac function depends on the myocardium's ability to combine the intake of different substrates. Experimental studies suggest that cardiovascular risk factors are associated with changes in cardiac metabolism. Mouse models of metabolic syndrome have demonstrated that there is a cardiac metabolic inflexibility associated with metabolic syndrome, characterized by impaired insulin-induced glucose uptake and oxidation that leads to cardiomyocytes' mitochondrial energetic impairment. This hypothesis that metabolic syndrome is associated with abnormal cardiac substrate utilization has been recently highlighted in pig models of metabolic syndrome, in which severely reduced availability of glycolytic pathway metabolites have